first presentation of sickle cell disease may be when they're 6 months old. They have swollen hands and swollen feet, and it's clear there's something bad going on. Those children are treated appropriately. They're given pain medications. Everyone wants to do everything they can to help the baby. As you grow older, you have less of those manifestations. So you can present with crisis, and there is no objective measure that they're having a painful event. And so they suffer needlessly because no one actually believes that they're in pain.
To the emergency room, there's a bit of a stigma where they don't want to see, it seems like they don't want to see you straight away. And I see a doctor that's not willing to give me the typical medicine amount of medicine that will help me get out of pain. It's emotionally frustrating, and then to deal with the stress of that on top of the pain already, it just makes it worse.
How's your pain level?
It's still a 7.
Once a patient has experienced 100 times over negative provider attitudes, you can imagine how they're going to feel when they present. And of course, then the provider now has more attitude because the patient has attitude, and so it becomes this circle and cycle of events which really leads to poor patient outcomes, and patients don't get what they need. It used to be taught, and you can still find it in places, that if a patient tells you what dose of narcotic they need to treat their pain, that was a sign of addiction.
It's not even the verbal communication, it's the nonverbal communication that really gets under my skin, because you get this look and this tone like, okay, you've already had enough medicine, so I'm not giving you any more, or you have to have felt something. That's the worst. When I hear you have to have felt that, you have to, and I'm like, no, if I did, I wouldn't be buzzing you every 10 minutes telling you I'm in pain.
The last thing you want to do is to piss off one of the medical staff, because you have to rely on them for care. And with a young family, I can't afford to be there around the clock.
When I'm in the hospital, I spend my entire time looking at the clock to make sure that I'm getting my medicine on time. I can't rest. I can't, I just have to make sure that after 2.5 hours, I need to start buzzing the nurse, because otherwise I won't get my medicine on time. I feel like it makes me look like that's all that I'm there for.
You can't tell them anything because they're the doctors. But I don't understand, what is the point in asking me my history on what works best for me if you're going to do what you want anyway and you're still not listening to me?
I'll go through extra measures of making sure that this is weird, but making sure that I'm dressed professionally before I go to the hospital, or not go in like sweats and in my socks, because I don't feel like I'm being taken seriously.
When you're sitting in an emergency room with a patient sitting across from you, what do you care if they're drug seeking? I mean, it's not your responsibility to make sure that the patient is not drug seeking. Yes, you soon send them home with 2 months worth of narcotic scripts. That's not your role in that setting, but you can treat the patient for their pain and manage their pain, and then refer them to someone who can take over the responsibility of managing their narcotics and seeing whether or not there might be an issue with their narcotic use. But in the emergency room setting, what difference does it make?